Together, we can make a difference. Why did my mother give birth to me? What was in her milk? Why am I suffering like this? In despair, Bulika left his home. He intended to take his life. Just the last week, his wife's relatives had come to their house and tried to make her leave him. Shamed, mocked, insulted. The man with the big feet. Bulika felt worthless. What good was he to his wife and children? They would be better off without him. How many of you have heard of Mossy Foot disease or podoconiosis? Okay, we have a few people, not many. Mossy Foot disease is a disease of poverty. It's caused by people being barefoot in the soil. And today I chose not to wear my shoes. If I were to put a dot on my hand, 5,000 particles of volcanic glass could fit into that one little dot. So the silica penetrates through the skin and gets into the lymphatic system. Everybody who is out barefoot in the soil has that in their lymphatic system. But about 1 in 13 develops an inflammation, develops an intolerance to it. Their feet start to itch and swell. They get gross on their feet, and after a while they look really, really grotesque. And they ooze a smelly liquid. They become the outcasts in society. Nobody wants to have anything to do with them. They think perhaps that was a bad person. Maybe they were evil, and that's why they got the disease. Or maybe somebody cursed them. Or, worse yet, it could be contagious. We better just avoid those people, make sure we don't have anything to do with them. So this disease affects them not only physically, but also socially and emotionally and economically. There are over 3 million people in the country of Ethiopia that are afflicted with mossy foot disease. The reason we say mossy foot disease is because the texture of the skin becomes rough, like moss that grows under a tree. So these people have a very, very sad life. It's very difficult for them. Many times family members will leave them. It not only affects the person, but it also affects the whole family. If there's one person in the family that is afflicted, nobody wants to marry anybody from that family. Children that are in school have to drop out of school. It stops their education. They're no longer able to till in the fields. And if they have a job, they most likely will lose their job also. So it's devastating to these people. With the Mossy Foot Project that began in 1997 that my dad started, we now have 30,000 people that we have helped. We treat about 2,000 in the month. These people come to Mossy Foot, a lot of them just really desperate, but they've heard about it from somebody else. Take Leah for an example. Leah was a young girl when her feet started to itch and swell. She was puzzled. She didn't know what was going on with her. She had long skirts, so she could hide a little bit when she went to school. But after a while, her feet got bigger and they started to smell really bad. She couldn't hide it anymore. The other kids would tease her. They'd say, Leah, what's wrong with you? Your feet smell bad. And then they stopped playing with her. Leah dropped out of school. She was doing just fine because she didn't have to confront this every day. But one day she went to the river to get water. And when she was at the river, at the spring, a mean lady said to her, why are you here? You want us to get sick too like you? And who wants to marry you? Nobody's going to want to marry you. Leah was heartbroken, devastated. She ran all the way home sobbing. She got more and more depressed. So finally she decided that the only thing she could do was do away with her misery. She got some bleach. She was going to drink it. She hid it under her mat at night. Her parents went out to work in the fields. Her brother and sister went to school. Leah started to sob. She was frightened of dying. She was also terrified of living. What was she going to do? She cried. The neighbors came, said, Leah, what's the matter? They found her. They took the bleach away. They talked her out of taking her life. That did not do away with Leah's despair. She still was under a black, black cloud of depression. So the next thing that Leah tried to do was to hang herself. She took her scarf and she put it around her head and tried to hang herself from a tree. But some neighbors saw her. They came running. Leah! They let her down from the tree and they invited her to go to church with them that Sunday. Leah went to church with them. Leah heard a message about the resurrection and that we would be healed and our bodies would be whole. She said, is that true? And the pastor said, yes. When the resurrection happens, there will be nothing wrong with you. Leah said, I want to accept that. I want to believe. And she did. Well, she still had the infirmity with her feet, but she went to the market. She was sitting there selling some things, and one of our workers came by and saw Leah and said, Leah, we have help for you. You can go to the clinic and get help, get treated. So Leah went to the clinic. She got help. Her feet improved. And today Leah is one of our social workers at our clinic, giving back again. A few years ago, my husband and I were out here doing Mossy Foot work. I heard a knock on the door. I went to the door and I opened it. There was Zalalam. His brother had brought him from Arba Minch, begging, please, do surgery for him. Just remove this. We explained to Zalalam that surgery was not the answer. This part is his feet. All the rest is growths. They were very hard, solid. If he had had surgery and gone back, he would not have had follow-up. Not only that, but the invasive surgery would have removed part of the lymphatic system that helps to clear and heal the person. So we said, sorry, no, we can't do that. I put big, oversized boots on Zalalam, the largest garden boots that you can get that fit over shoes. I saw him shuffle back to the station, to the bus station to go home. He was so disappointed, so discouraged. After his feet were treated for a while, he was given some things to help treat his feet. He did this for 16 months, kept coming back and getting treatment kits. This is Zalalam now. Our treatment is so very, very simple. You will be astounded. First, we wash the feet really well with soap and water. And we have to lift up all the little flaps, get a little piece of gauze in there, saw in between to get it very, very clean. After we wash with soap and water several times, then we put 1 capful of bleach in a gallon of water, and they soak their feet in that for about 20 minutes a day. The next thing we do is we teach them how to self-massage their legs, to do lymphatic massage, and we put on Whitfield ointment. If their feet are swollen, if they have edema, we wrap their feet with bandages in their legs to help the swelling go down and stimulate the lymphatic system. We have oversized shoes that our shoemakers make. Have you ever seen a sole this big? These shoes are made by our shoemakers. All of our shoemakers were Mossy Foot patients themselves. The sole is cut out of a tire because the feet are too big to fit into a shoe that we could buy a sole. That's a very simple treatment. It's easy to do. You think of 4 million people in Ethiopia that are suffering from a terrible disease that makes them outcasts of society, that totally ruins their lives. And yet, there is hope. And it's such a simple solution. Fulika, who I was talking about at the very beginning, that wanted to take his life, is now our lymphatic specialist and also our wound care specialist. He loves the people so much. He's just somebody who's so full of love and compassion. So he has turned this ability into a real asset. He's found his purpose in life. And most of our workers, we have 70 workers here in Ethiopia, most of them were Mossy Foot patients themselves, and now they are serving others that have this problem. And the people that come to our clinics are also going up into the villages. They are finding people that have Mossy Foot disease and saying, I used to look like you. My feet were like yours. Come to the clinic, and they bring them to the clinic. And when they come to the clinic, it's just like a family for them. They've been outcast. But here are people that say, come, we like you, we love you, we care about you. We don't worry about your feet. You are a person. And that's what I feel too. It really touched my heart, my husband's heart, when we came out here in 2004. My dad was ill. He was laying in bed. He had horrid ulcers on his feet, not Mossy Foot, but horrid, deep, red ulcers. And I remember him saying, I just wish that everybody could have shoes. Because we could prevent this problem if everybody had foot protection, everybody wore shoes. So that's one of the goals that we have, is to educate the people so that everybody will wear shoes. We get the children early on. We educate the parents. We tell them, your child is not dressed unless they go outside with shoes on their feet. So we're doing education on wearing shoes, and we're doing the treatment at our 17 clinics. We're also doing income-generating activities and vocational training, because this is a disease of poverty. People are too poor to afford shoes. 90% of the people that have this disease are farmers out tilling in this volcanic soil. Where we work in Waleta, that's what the majority of the people are doing, is farming the land. So they're out in that. It's not just casual contact. They're out there in that mire. They sink into it, and they're exposed to it about 8 hours a day or more. Then they come home to their little house with a dirt floor. They have to walk 5 to 7 miles to get water and carry it home. So it's a very difficult existence for them. So we're working on the underlying cause, which is poverty, giving them vocational training and also income-generating activities, because we need this to be sustainable. If we just hand them treatment, hand them money, it's not going to be sustainable. They'll depend on us always. So we do require that the patients give us 10% of what it costs for these kits. If they're able, there are few that are not, but on the whole, they do pay for their kits something, and they do pay a small amount for their shoes. But when I think about it, Whitfield ointment, bandages, socks, our shoes, for the treatment kit, I was thinking how much it costs. It costs about what you would pay for a macchiato. That is, I'm sorry, that would be, if you're treating a patient for 1 month, what you pay for a macchiato each day that month would take care of the treatment for one patient. Can we make a difference together? I believe that we can. This is a disease that can be totally eradicated. It is a disease that does not need to exist. It's a disease that together we can tackle, we can do away with it. Together, we can make a difference. Thank you, ladies and gentlemen.